According to the CDC, nearly 25 million adults in our country have high cholesterol. One Greensboro man knows all about the condition all too well. Andy Coren, the senior rabbi at Temple Emmanuel Greensboro, was diagnosed with high cholesterol. It runs in his family. His grandfather passed away at 68 from a heart attack. His father died from heart complications at that same age. Rabbi Coren is now in his late 50s.
Our emeritus rabbi, Rabbi Fred Gutman, he had a really great piece of advice, which is that, rabbis, clergy, we're not the only ones, but we are in high-stress jobs. And so it's really important once a year to check with a cardiologist. So in addition to your primary physician, to also enlist a specialist who can talk with you about heart health. And like so many things in life, you get advice, but this is one that I'm really glad that I acted on.
Rabbi Coren says medication has been instrumental in treating his high cholesterol, as well as healthy diet and exercising more. Dr. Kenneth Hilty, a cardiologist with Cone Health, helps treat patients with the condition. He says in general, people won't know if they have high cholesterol unless they get tested.
You probably should get testing. Maybe it's recommended as early as in your 20s, especially if you have a family history of heart disease or high cholesterol. And really, the key is the earlier that you can identify risk and treat it, the better your long-term outcome will be.
So we're going to continue the cholesterol conversation with Dr. Kenneth Hilty with Cone Health Healthcare. All right, so let's just start off. Let's talk about the dangers and the complications that could happen if high cholesterol is just left unmanaged.
Yeah, thanks, Tanya. Thanks for having me back again. What we worry about is the development of cardiovascular disease. Cholesterol takes about 10 years for a cholesterol process to develop that. So, and again, you may not have any symptoms with that. And that's why it's important to kind of identify high cholesterol early and treat it aggressively. If we're aggressive at preventing that, we can prevent the development of heart disease.
All right, so many people hear, oh, I have good cholesterol or I have bad cholesterol. Let's talk about what the difference is between the good and the bad.
Yeah, traditionally when we do a lipid profile, we're looking at what we call the good and bad cholesterol, as well as the total cholesterol, the bad being the LDL or low density lipoprotein cholesterol. And that's primarily been our target of therapy because most of the studies show if we can lower that LDL cholesterol to low levels, we can prevent events. There has been some study and research in the balance between HDL and LDL cholesterol, although more data is suggesting that we should focus on LDL. HDL is typically improved with things like exercise and healthy diet, and LDL cholesterol is also primarily driven by diet, but also genetics. In fact, a lot of patients have high cholesterol despite healthy diet and lifestyle, and that's driven a lot by your family history and genetics, as you've seen.
All right, so often people get their blood work back and they're looking at numbers. What numbers should people be aiming for when they get their cholesterol screened?
Well, again, I tend to focus mostly on the LDL cholesterol, the bad cholesterol, but we also see patients with very high triglycerides. That's fairly common as well, the triglycerides being sugar-related compounds in the bloodstream. So I would look at both of those, really all the numbers.
Okay. And in addition to checking your cholesterol, what other tests or services should people talk with their provider about when it comes to this?
I think that's a good start. I mean, I think talking about your diet and what you can do with your lifestyle to improve that. But I think if you're having trouble with that, and that's when we start to recommend therapies, right? And so there are medications and therapies that are out there, generally well tolerated by a lot of people. In some cases they're not. And then we have options for them. And that's why we, have a lipid clinic at Cone Health. In fact, we have a comprehensive prevention clinic as well. And this allows us to really address all these facets beyond just the cholesterol. To really look at overall cardiovascular health.
Okay, and we're going to talk about the things that we eat that may be good or bad for our cholesterol. We're going to tackle that when we come back after the break.
All right, thank you.